Obesity is a healthcare problem. It is a disease, so we have to treat these patients with non-operative treatments or operative treatments. According to the World Health Organization, there is an index to describe the obesity and overweight or morbid obesity. For example, if the patient has a BMI index of more than 30, this is called overweight. And if it is more than 35 and has comorbid disease, we call this morbid obesity. And if the patient more than 40, this is also called morbid obesity. And after the 50, we call this super obese. There are a lot of obesity surgeries which are done all over the world. In our country and in all over the world, the most common one is sleeve gastrectomy. Sleeve gastrectomy means taking about 80% of the stomach and make a tube of stomach, and that makes early satiety, and that makes restriction of the food. And also there is an area in the fundus, we take it out, this area, and the patient can eat less, and he or she doesn't want more food. Another surgery is gastric bypass. Gastric bypass is another restrictive and also malabsorptive procedure. And there's a lot of other procedures, but the most common one, these are two operations. And sometimes some surgeons makes a adjustable gastric banding, but now all over the world it is very less among the surgeons. When the patient admit to us, we first check some blood tests, and also we request some endoscopy and also ultrasonography and some consultations. For example, endocrinology consultation, psychiatric consultation. And after these all tests completed, we decide which operation we have to do. If the patient has no reflux, and if the patient is not a sweet eater, we mostly recommend a sleeve gastrectomy. And if the patient has a gastroesophageal reflux disease, severe gastroesophageal reflux disease, or if she is sweet eater, then we recommend it gastric bypass surgery, because after gastric bypass surgery, this kind of surgery is also malabsorptive procedure, so the patient can eat but doesn't gain weight. Sleeve gastrectomy is a procedure for morbid obesity. If the patient who has a body mass index more than 35 and have comorbid disease, or 40, more than 40 kilogram per meter square, we offer this kind of surgery. We are taking out about 80% of the stomach and shaping the stomach like a sleeve. So this is a restrictive procedure. The patients eat but not too much, and then they lose weight. Sleeve gastrectomy is a losing weight procedure. So there are many advantages. For example, patient can use some medications for hypertension or for insulin resistance. So after this operation, they can stop these medications. Also, obesity makes some sleeping problems, and after this procedure, the patient can sleep well and can easily walk, can easily run after the 6 months, for example. And the other advantages of sleeve gastrectomy, when we compare the other operations, we are not changing the gastrointestinal system. So not like, for example, when we compare to gastric bypass, it is a normal system. And we only take out 80% of the stomach, so patients can eat, can have their vitamins and iron per mount. So we don't have to give them intravenous medications or replacements, intravenous replacements. All replacements can be per oral. So these are the advantages of the sleeve gastrectomy. Obesity surgery is an operation, but not riskful. More riskful than the gastric surgery. But according to the patient comorbid diseases, there can be some risks. For example, if patient have a chronic obstructive pulmonary disease, or if the patient has a diabetes, so that makes this surgery riskful. But according to the BMI or according to the operation, this is not more riskful than the gastric surgery. Usually we prefer to do this kind of surgery by using robot. Robotic surgery means we use robotic system, and this is a minimal invasive system, and there is some holes, not more than 1.5 centimeter, and about 4 or 5 holes in the belly, and we operate through these ports. And this is a minimal invasive procedure. The operation takes about 45 minutes or 1 hour. And after the surgery, we take the patient to the service, to the clinic. And 1 day after, we check the sleeve gastrectomy. If there is no any complication, we feed the patient with liquid food. Then after that, we give him or her some elementary diet, and after 1 month, the patient can eat everything. After the obesity surgery, we recommend the patient to do the exercise or some sports after 1 month, but it shouldn't be a heavy exercises like walking or swimming, like these exercises. But after 6 months, we can, after losing some weight, we recommend them heavy exercises as well. if the patient wants to have this surgery, first we have a 1 week for the preoperative period. We advise patient to take liquid diet according to the nutrition orders. And this 1 week period also we take the tests, preoperative tests, and also anesthesiology examinations. And after 1 week we operate the patient, and then after postoperative day 2 we send to the patient to the hotel or any house in Istanbul. And after 1 week, the patient can go to his country. Sure, patients have a baby after this kind of surgery, but for pregnancy we recommend to be pregnant after 2 years after this operation. After this kind of surgery, we have some control visits for the patients. One of them is 1 week after this operation, and we begin some supplements to the patient, some vitamins or some minerals to the patient according to our nutritionist and our nurse. After that supplement treatment, we send him or her to his country. And one month later, we check some blood test levels, B12, B1, B6 vitamins, and calcium and iron. We take this tests, and we have to see these are normal or not normal. If there is any deficiency, we replace these minerals to the patient. Control visits are postoperative 1 month, 6 month, 9th month, and postoperative 1 year. And after that, the patient can do his life or her life without any control. After the surgery, we figure out the diet program of the patient according to our nutritionist. 1 week is important, or 10 days is important. We give liquid diet, and after that we give soft diet 10 days, and after 20 days we give solid food, but elementary food, not complicated foods. And after 1 month the patient can eat everything but small portions. This kind of surgery is not a magical treatment. If patients wants to eat, she or he can eat, and she can largen his or her stomach. So our aim is to change her or his lifestyle to be healthy and to be fit. And if the patient has can place an exercises and also regular eating habits, the patient cannot gain weight after this surgery.